I'm a pediatric ER doctor, and one of the common reasons we see kids in the emergency department is that their coughing is driving their parents wild. For kids over 1, the data actually shows honey is your best option, can be given a spoonful every couple of hours. Postnasal drip also contributes to coughing, so irrigating the sinuses with saline. Do not use tap water, please. Brain amoebas are bad. Cool mist humidifiers are also awesome. They keep the mucosa nice and moist while they're sleeping, and it keeps the mucus nice and thin so that it comes out very easily. Electrolyte beverages are also important for hydration, especially if they're not eating and drinking. It has electrolytes and sugar in it, which is important, especially for younger kids. Coughing can be really uncomfortable, but we need to shift the focus from suppressing the cough to keeping them comfortable while they're coughing. So using ibuprofen and Tylenol to keep them comfortable. If they're not willing to swallow medication, there are some Feverol suppositories that are an option. There are some bigger ones at different stores, like 120 milligrams. There are a ton of options for acetaminophen or ibuprofen. Just take your pick. For little kids especially, they're going to be much more comfortable with their nose clean, so using nasal saline mists and drops and whatever suction apparatus you want to use that works for you is going to keep them breathing comfortably and is going to be your first line of defense. We need to see kids in the emergency department if they're struggling to breathe, using extra muscles, breathing fast, or have any change in mental status. Otherwise, you can give your pediatrician a call for more help.